Hello and welcome back to the Modern Pain Physician. I'm your host, Dr. Kent, board certified interventional pain physician here in Bend, Oregon. Today I wanted to talk with you about two different types of stimulation technology. Stimulation meaning delivering energy to the body in some ways to help with pain. And what we're going to talk about are the differences between spinal cord stimulation and what's called Reactivate, or a peripheral nerve stimulator, and both of them in regards to back pain. So spinal cord stimulators are essentially, they were the first type of technology developed to help with pain by delivering energy to the body. And so what they look like are essentially placing wires, you see these wires kind of on our spine model here, that sit along the spinal cord itself. The spinal cord, or this technology, has been around since about the 1980s, so it's not new, but the leads or the wires actually sit right along the spinal cord, and they have these little electrodes. And what happens is that the battery that is implanted, and the battery looks similar to that in size, the battery delivers energy essentially to the spinal cord itself. And what it's designed to do is just block pain signals. And so it's a way to help people with pain when we don't have a whole lot of other solutions for pain, to try to just make it so you just can't feel it. The process is basically you come in and you have the wires put in there temporarily to deliver energy to the spinal cord, and then you have those wires in for a period of time, usually anywhere from 3 days to a little over a week. And during that period of time, we're trying to assess, will this technology help with your pain? And so during this period of time, I ask folks to kind of, try to recreate, a typical day. There are some caveats because we don't want these wires to move while they're in there. It's not dangerous if that happens. It's just when we're trying to figure out if this device works, these wires need to be in very specific locations. And if they move too much with the way the body's moving, then it can be difficult to try to find that sweet spot to see if it'll help. And it may make it if the leads come out, then that's kind of the end of the trial to see if it's helpful. Typically, spinal cord stimulation, where it works its best, is for people with basically chronic nerve pain. And this can be nerve pain that is primarily felt in the back, usually is not necessarily activity dependent, but is kind of there all the time. Can be associated with sensitivity just in the low back area. This also can be done in the neck, and so this is another area that I routinely use this technology. But more commonly, it's used for signals that are pain signals that start along the spine and kind of radiate or go down into the arms and the legs. And that's where the technology is at its best. And so that's primarily what we're treating when we put this device in, is we're trying to treat basically nerve pain. The other type of stimulation technology that's specifically for back pain is called Reactivate. And so Reactivate is a newer procedure, and it is technically a peripheral nerve stimulator. So it's very different than a spinal cord stimulator, though there are some similarities. A peripheral nerve stimulator is still delivering energy to the body, but instead of delivering it to the spinal cord itself, you're actually stimulating or delivering energy to nerves that go to the muscles. And so in this model, you can see there's these wires kind of curled up, and these little wires essentially sit just along the bones of the spine. It's not along the spinal cord like we talked about with the spinal cord stimulator, but it's just sitting along the bones of the spine, and it's stimulating what's called your medial branch nerve, which is a branch off the nerve that allows you to control your legs. And so that little medial branch kind of comes around into this little groove where these wires sit, and what that nerve's responsible for is to stimulate what are called your multifidus muscles, which are these little tiny muscles just along the spine that help stabilize the spine and support the joints, the discs, basically allow you to move. And so this is a very targeted therapy specifically for treating muscles that are no longer working properly, and oftentimes are associated with weakness or atrophy that we can see on things like an MRI. So this procedure has been around internationally for about 15 years. It's only been around in the United States for about 5. It recently didn't become widely available until the last couple of years as Medicare created basically a diagnosis code. And so over the last couple of years, this technology has essentially exploded for people with what's called mechanical back pain. And when I think of mechanical back pain, I'm talking about back pain that is worse when you use your back. And so this can be when you're standing, it can be when you're walking. Typically gets better if you don't do those things. So you sit down, your back pain feels a lot better. You get in your easy chair, your lazy boy, kick your feet up, and you can get in a comfortable position. That is what I think of as mechanical back pain. And so this device is specifically designed to treat that type of pain. And so the device, like we talked about, sits along those medial branch nerves, and what it involves is this device is not used all the time. So that's another difference between a traditional spinal cord stimulator and this Reactivate device, is this Reactivate device is only used for 30 minutes twice a day. Usually my patients will use it at night before they go to bed. They'll hit a button, their muscles will start jumping around. People describe it kind of like a back massage. And then that device it'll turn off automatically as you go to sleep. And then in the morning, they repeat that, hit the button, wake up to a back massage, and then go along with their day. What happens is it creates a feedback loop. So your brain recognizes that those muscles, those stabilizing muscles right along the spine, are basically getting dedicated, high-intensity therapy, physical therapy, twice a day. And over months, what happens is it improves that connection, so those muscles are more reactive. And so when you are standing, walking, all of a sudden bending down to grab something that's falling, it's able to stabilize the bones and the joints and the discs of your spine so you don't have injuries in your back. So people that will commonly, with multifidus dysfunction or multifidus atrophy, they'll describe this activity pain, they go to grab something and all of a sudden their back goes out. And that is because these muscles are not engaged fast enough to basically support your back quick enough, and then you end up with injuries. This can often result in a lot of muscular tenderness in the back and spasming. People describe trigger points in their back because basically the muscles, they're just not strong enough, and when they're not strong enough to support your frame, they can become injured. And so that is a very common thing that happens for folks with weakness and dysfunction of these muscles. And I want to make that distinction between weakness and dysfunction. So weakness, basically signs of atrophy, signs of weakness, generally occurs as we age. That's something called sarcopenia, and so our bodies naturally lose muscle mass as we age. But what doesn't change as we age is typically our body size. And so we are just as big as when you are 70 years old, and sometimes bigger. Maybe you've shrunk a little bit, but essentially you're the same size as you were when you were 20. But your muscle mass is very, very different. And so oftentimes people with weak back muscles, it's just a part of the aging process. But that doesn't mean it's normal. That just means that happens. And we also know people get more back pain as they age, all associated with this muscular weakness. The other thing that can happen is people that have back injuries can develop what's called dysfunction, multifidus dysfunction, meaning that there's the connection between the brain and those muscles gets disrupted. The muscles haven't atrophied yet, and when you still look at an MRI, there still shows good muscle mass, but the muscles just don't work as effectively, or they're not as responsive as they need to be. And that's where Reactivate also excels, is to retrain those muscles to start functioning appropriately, to allow especially younger folks who have mechanical back pain to not have these flares of symptoms and allow them to get back to normal life. And so the stimulator therapies, they're similar in several ways, that they're delivering energy to the body, but the devil's in the details. It's what you are stimulating. For spinal cord stimulator therapy, you're stimulating the spinal cord itself, and that is a palliative treatment, basically just designed to try to block pain signals, okay? Works best for nerve damage, nerve-related pain, especially after several surgeries, that type of thing. Reactivate, on the other hand, is a peripheral nerve stimulator. It does have a battery, just like a spinal cord stimulator, But the difference is that this is not designed to block pain signals. It is designed to restore or re-strengthen your back so you stop injuring your back and you can start walking and moving. And so they're very different therapies. They treat very different things, and they're both exceptional for treating those things, but they only treat those particular problems. So I hope this was helpful to kind of shed some light on the newer types of stimulation therapy specifically for back pain. I encourage you to look at my other videos as I talk about other causes of back pain and other new treatments. Thanks for tuning in, and we'll see you in the future.